A shoulder dislocation is an extremely painful shoulder injury. In this video, I'll discuss how they occur, what the initial treatment involves, when it needs surgery, and what the recovery entails. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. A shoulder dislocation is fairly self-explanatory. Basically, the ball pops out of, if I can show you there, the socket, and it's a traumatic injury. Now, yes, there are people who are naturally sort of have lax ligaments for medical reasons or genetic reasons, and it sort of pops out without any initial trauma. But most of the time, what we're talking about is some sort of traumatic force that drives the ball out of the socket, much more commonly out toward the front than the back. Sports like football and other contact and collision sports, where either you land on your outstretched arm or have your arm pulled out back behind you, are the common ways to do it. Obviously, the initial treatment is getting it back in place. Some people can do that if they kind of do it on their own right after the injury occurs. But even within minutes, that deltoid muscle, which you don't see in this model, but the big muscle that covers the shoulder, this muscle, starts to spasm. It starts to tighten and try to guard the shoulder. And then it's really hard for that muscle to relax and you to get it to relax to pop it back into place yourself. So that involves going to an emergency room or somewhere where they can give you some sort of sedation, have that muscle relax, and then somebody pops it back in place. Now, historically, we treated these usually with surgery, basically, or without surgery, putting it in a sling or a brace for 3 weeks or 6 weeks, and then say, hey, it's going to do fine. That didn't turn out to work that well, especially for young people, teenagers, early 20s. Very, very, very often, those turn into recurrent dislocations. And usually each time it dislocates, it's less and less trauma that causes it. And why that is when it pops out the first time, the capsule that surrounds the shoulder, as well as the labrum along the socket, tends to tear. And then all of a sudden now there's really no stop to that. And then you're relying just on muscle strength to basically hold it in place. You get a fairly minor event and it pops back out again. So we've gotten much, much more aggressive fixing these surgically. Now, fortunately, it's an outpatient surgery. It's almost always arthroscopic, assuming there's not other damage involved, usually tightening the capsule and reattaching the labrum with stitches and anchors that are buried into the socket. Short surgery, like I said, 15, 20 minutes even surgical time, but it's a fairly long recovery, protecting that repair, keeping you in a sling anywhere from maybe 3 to even up to 6 weeks, then getting your motion back and getting your strength back and everything you need to be able to do overhead for your sport or activity, your exercise, whatever it is you do. Now, can some of the regenerative treatments help with that, especially in the recovery phase? Potentially. It's never really been studied for those purposes, but in terms of maybe strengthening the muscles and strengthening the repair, maybe some of the peptides would be helpful. I'm not aware of any studies for that or physicians that use them for those purposes, but conceivably that could help. But again, most of the time, fixing it surgically and then getting with a physical therapist who's really, really good at rehabbing these types of shoulder injuries and working really hard on your recovery is what it takes to get better. Now, I'd love to hear your experience with your shoulder injury, so leave those in the comments below. Please understand I can't offer you medical advice, but I'll try to answer your question in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start a live stream, such as my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other joint pain and you want to get significantly better in the next 30 days without cortisone shots, without physical therapy or surgery, learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.